Good afternoon, everybody. Thank you for having me and for the introduction. So I am a thyroid surgeon. I have dedicated my career to only performing thyroid surgery. Our hospital right here in Tampa, the Hospital for Endocrine Surgery, is the first of its kind in the country where we are a specialty hospital and all we perform is surgery for endocrine organs. So thyroid surgery, parathyroid surgery, and adrenal surgery. And those specific surgeons only perform on that organ, which is pretty special because it just shows how expert we are in what we do. So I probably perform more thyroid surgeries than anyone in the country. As a group, we definitely perform more thyroid surgeries than anyone in the country, possibly in the world. So people come to see us from all over the country and internationally. 50% of our practice is actually out of state. But I really wanted to focus on our community here in Tampa. So about a year ago, I did our first screening program and the results were shocking. And the reason why I thought of doing this, our team thought of doing this, is because thyroid cancer is the fastest growing cancer in women. It's 3 times more common in women than men, and it's now the 5th leading cancer in women. And so what I would always hear from my patients is, how do I have thyroid cancer? I have no symptoms, my thyroid function is normal, I'm on no medication, how is this possible? How do I not know about it? And so we decided to do this screening program, and the results of our first program were shocking. So approximately 40 women were screened in the first program. Half of them had abnormal findings, and then half of those women needed a full evaluation where it was such an abnormal finding that it needed a biopsy. Half of those women needed surgery, and then half of those women had a thyroid cancer. So I've now continued to do programs for women's events. I did a program at my son's school, and so I am submitting all this information to the national board because my goal is that women at 35 should get a screening ultrasound. Just like women should get a mammogram at 40, at 35 you should get a screening thyroid ultrasound because that's the only way you're ever going to know if you have a thyroid cancer. It's curable, but you need to know about it. So what I found so far is that 1 in 6 women will need a full thyroid evaluation, which means an ultrasound of your thyroid, the lymph nodes, and a biopsy. And if you have a thyroid cancer, don't panic. It's not an urgency, but you just need to take the next step. So I urge you, it's super easy. We have the best ultrasonographers in the country back there. Just super easy to get an ultrasound. If you have something, we'll take care of it. If you don't, at least you know. But we're here for you. We're right here in Tampa. We're world experts and we're in your backyard. So come see us and enjoy your life.